It has been a common norm to commemorate the World TB Day to help raise public awareness about the devastating health, social and economic impacts of tuberculosis and urge acceleration of efforts to end the global TB epidemic. This year 18th day of March 2021 is dated for the pre-World TB Day press briefing held in the Federal Capital Territory of Nigeria by the National Tuberculosis and Leprosy Control Program in collaboration with Stop TB Partnership Nigeria under the umbrella of the Federal Ministry of Health. The press briefing is aimed at sharing information on the activities planned for the 2021 World TB Day and also to create more awareness on TB, especially now that the COVID-19 virus disease has similarities in terms of symptoms to the tuberculosis. The theme for the World TB Day was disclosed as "The Clock is Ticking," and it is adapted for Nigerian as "The Clock is Ticking to End TB in Nigeria."
I want to begin by saying that this year's World TB Day is unique, as it marks 1 year since COVID-19 impacted the global body. Last year, the World TB Day took a different turn, as most activities were unable to hold due to the lockdown directive by the government to curtail the spread of the coronavirus. As you know, on Wednesday, 24th March 2021, Nigeria will join the global community to commemorate the World TB Day to raise public awareness about the devastating health, social and economic impacts of tuberculosis and urge acceleration of efforts to end the global TB epidemic. The date marks the day in 1882 when Dr. Robert Koch announced that he had discovered the bacterium that causes TB, which opened the way towards diagnosing and curing this disease. The theme of this year's World TB Day is "The Clock is Ticking," and the slogan, "That cough fit be TB, not COVID. Check 'em all." This sounds the alarm that now more than ever we need redoubled efforts to raise awareness and ambitious commitments and mobilize the very needed resources to help achieve the UN high-level mission target by 2022.
The clock is ticking, because when we say not COVID, it could be the two, because someone with COVID could also have TB. So when we categorically say not COVID, then we are sending another message out. So it could be TB and COVID. But what we need is to make sure that we check, go for test, and be tested for both. It's possible. So please, I want us to also encourage that they test for COVID and TB. And so that helps us to be able to pick even those that have TB amongst those with COVID. Now for us, we want evidence-based information, and that's where we come with data. For NCDC, we work with data. And so all our actions are data-driven. So we're supporting the TB control program with data generation. And how do we do this? We're looking at how they can collect comprehensive data from the field. And so we have a platform called Surveillance Outbreak Response Management Analysis System, called SUMAS. And that platform helps us to not only collect the data, but also helps us to manage the cases, and also helps us to track cases, track their contacts. So that's the support that NCDC is giving to the control of TB.
People should know, however it is, you must go to the hospital. It's only when you get to the hospital you see the healthcare providers and they will do the necessary investigations and now tell you that this is this. It's either COVID-19 or tuberculosis. Unfortunately, both come with the same symptom, cough. Cough is in between them. So it's only when you go for the test that you will be able to say it is this. If you go, they will screen for the COVID-19. When you are negative and you are still coughing, then we'll go to the next phase. Fortunately for us, we have the, very sensitive diagnostic set that will tell us whether you have tuberculosis or not.
Despite the pandemic in 2020, last year we had the pandemic, despite the lockdown measures that was for about 3 months, the TB program in Nigeria recorded an increase in number of cases. And last year, which was the year of pandemic, happened to be the year they have the highest number of TB cases. If you see, the cases increases from 120,266 in 2019 to about 138,573 in 2020. I think the program deserves a clap. Most countries that we have seen, the cases are went down during the pandemic, but Nigeria, our cases is on the increase. So which means there's something that we are doing that is right. That means we are on the right path. If you look at our commitment in 2018 that we made, that the country, Nigeria, made to the UN high-level meeting on tuberculosis, we made a commitment to diagnose and treat about 1 million TB cases between 2018 and 2022. We also made a commitment to put over 1 million under 5 and above 5 contact on tuberculosis TB preventing therapy. If you look at the progress we've made since then, you find out that in terms of the cases diagnosed and put on treatment, we have been able to only achieve about 32% of that target. And in terms of TB preventing therapy for under 5, for above 5, we were only able to achieve less than 10%. And we are less than 2 years to go, which means even though we are on the right path, we are like strolling instead of running. We're like walking instead of flying. So which means we need to do a lot of things.
Most of our primary healthcare centers in Nigeria already have TB clinics. But the thing is, are people confident to walk into these centers? Are they confident that when they get there, they will find drugs, the laboratories will be working? So this is also a call. There's a funding gap, but the reason why the funding gap is also so high is because there's nothing to fall back on. The private hospitals that we have, is their care standardized in any way? The laboratories that we have, are they standard? A lot of people go to laboratories as their first point of call when they have something. When they get there, are they assured of good TB tests?
Ticks-KNCV in the state will work directly with the TB program, not only supporting facility-based active TB case finding, what we could name the TB Surge, where we ensure that every person that enters any facility across these 14 states are screened for TB. The great success stories, people that accompanied sick patients to the hospital are being found to have TB across the sites we work. And another new thing in our work last year in the midst of COVID, that we've noticed that with the stigma associated with COVID and knowing the similarities between the symptoms of the two diseases, even people that have cough out of fear of COVID actually denying they don't have cough. People that are sick out there in the community. And our intervention had focused in community active TB case finding. As you have heard from USAID, with their support, we've deployed new technologies, all which we do hotspot mapping to know the exact locations we have those TB cases within the community. And with the funding from USAID, we've deployed resources to be actively looking for these TB cases within the community. Our work did not stop in community engagement. We all know that in Nigeria, that 60% of the populace seek for care in the private sector. And there's no way we can control TB without having a handshake with the private sector. And in the states we work, I must commend some of the state government that had shown very great interest in what we do, that have partnered with Ticks-KNCV in addressing the TB scourge in their states. And Not only Kaduna State, but I may need to mention Kaduna State. Ticks-KNCV had partnered with Kaduna State, and the results had been very phenomenal. They have procured GeneXpert machine that had worked with us in COVID-TB integration. And as I talk to you now, most GeneXpert sites in the state will work in Kaduna are being supported by the government with high-capacity solar panels and some IPC measures, even training of staff.
Zainab Ahmed, Voicetv, Nigeria.